Greetings. My name is Dr Simani Gaseitsiwe. I hail from a beautiful village known as Matangwani in the north of Botswana. My academic background, I did my Bachelor's of Science in Medical Laboratory Sciences in the US, the University of Pittsburgh, finished in 1998. And then I came back to Botswana, worked for a short while at the Institute of Health Sciences as a clinical chemistry lecturer. That was from 98 up to the end of 1999. Then in 2000, at the beginning of 2000, I had an opportunity to join Botswana-Harvard Partnership as one of the laboratory scientists who started the BHP lab. At the time, as you can imagine, the early 2000s, that was the peak of the HIV/AIDS epidemic in Botswana. And at the BHP lab, as the lab was starting, our focus was basically to support all the different programs that were being started in the country, like HIV treatment and also some HIV vaccine research and also prevention of mother-to-child transmission. So basically that's when the BHP lab started in 2000 February, and I was one of the first lab scientists to work there. And then in 2001, I got an opportunity to go to Harvard University, Harvard School of Public Health, where I spent a year in Professor Max Essex's lab. I was basically training on advanced HIV molecular biology research work. At the time, we were trying to characterize the HIV strains that are circulating in Botswana, as those are important in terms of vaccine design and also treatment. It was a great opportunity for me because I got to interact with different young scientists who were working in Max's lab in Boston. And at the end of 2001, I came back to Botswana, and that was when the BHP lab now was expanding and started in the new building. So from 2002 to 2006, I was quite involved in the activities of the BHP lab, which was doing a lot of research work, continuing with HIV treatment and also HIV prevention work. We had a number of HIV vaccine trials that we were part of, and a number of trials on prevention of mother-to-child transmission, and also trying new treatment guidelines for HIV at the time. So that was from 2002 up to 2006. From 2006, I got an opportunity to go for PhD training, which was funded by the European Union. And this was in Sweden at Karolinska Institutet. The PhD work focused on understanding the interaction of HIV and TB co-infections. And I still think Max was one of my co-supervisors for my PhD work. And this was when I was also introduced to TB as a pathogen, which is, as you know, very interactive with HIV. I think we've seen in Botswana that the incidence or the prevalence of TB increased drastically once we started having HIV, the HIV pandemic. So post my PhD, which I finished in 2009, I had a short stint as a postdoc at the Swedish Institute of Infectious Diseases, where we were still working on identifying TB and also HIV CD4 T-cell epitope, which is work that is important in HIV vaccine design. So at the end of 2009, then I was recruited by Max to come back to BHP to be the deputy laboratory director, with focus on the research lab. So I started that position at BHP in 2010. So from 2010, I was working as the Deputy Laboratory Director. I think the focus there was to expand our HIV research work and also get to work on other co-infections like TB, and also we further included other co-infections like viral hepatitis, specifically hepatitis B virus and also hepatitis C. I think in that process, then we also got to collaborate with a number of academic institutions and locally, University of Botswana specifically, and also Botswana International University of Science and Technology, and more regionally with universities like University of Cape Town and University of KwaZulu-Natal, because as you know, Botswana-Harvard Partnership is a research institute but not an academic institution. So we wanted to collaborate with academic institutions where our fellows could register for their graduate degrees, masters, and also PhDs, and then do their research work at BHP. So this was basically now coupling the research work that we do in the lab and also training of young Botswana and also young scientists from the region to PhD level. So I think that is an exercise that I have been involved in for quite a while now. So I think from 2010 up to 2016, then in 2016 I got to be the BHP Laboratory Director, which involved now encompassing both the research lab as well as the clinical laboratory, which does a lot of support for the clinical trials work that have been done at Botswana-Harvard Partnership. So I carried on those roles until in 2019, where I now I became a research associate and a principal investigator, still focusing on my research, which focuses on HIV, TB, and viral hepatitis, and mentoring younger scientists. I think this is a position that I hold now, and in that effort, I also oversee the activities of the BHP Research Lab, which has generated quite a number of PhD graduates. I think we have so far graduated close to 12 PhDs and 10 Masters of Science and Masters of Philosophy in Science, with their research focusing primarily on HIV and associated co-infections, viral hepatitis, hepatitis B, and also TB. And importantly as well, in 2020, when COVID hit the country, our lab was quite instrumental in the supporting the response, the national response, the global response. As we had learned from the lessons from HIV, it was easy for us to adapt to support COVID testing and also do the pathogen genomics work, which led to the first sequencing of the Omicron variant globally. It's been a really wonderful and fulfilling journey being a research scientist, a medical research scientist in Botswana. And I think what is gratifying is the ability to be able to contribute to our understanding of these pathogens, which impact our country so much and also impact the sub-Saharan Africa region so much. And seeing the young scientists that are being groomed, but also in the process getting recognized for some of the work that you do at a personal level is also quite gratifying. The opportunity that I got to go to do my PhD at Karolinska was quite a unique opportunity for somebody from Botswana, as I was the only African who was funded at the time by the European Union. And also recently, I think I was the second recipient of the Festus Mogae Clinicians Biennial Award, the recipient of the Festus Mogae Biennial Award as a top researcher in Botswana in 2018. which was a culmination of basically the appreciation of the capacity building activities that I'm involved in training young Botswana in HIV and also other pathogen research. And also the more recognition of the laboratory and also colleagues at Botswana Harvard in the discovery of the Omicron shows that the work that we are doing is impactful and also is getting recognition, which of course is quite important. I think one of the main challenges that we face as researchers in Botswana and regional and sub-Saharan Africa is the limited support for doing the research work. Research by its nature is resource intensive, but it can be it can yield quite important results, and it can also be economically supportive in terms of generating products. And a simple example is that when you look at infectious disease globally, Africa has the highest burden and prevalence of infectious diseases such as HIV and TB and malaria. But you look at the funding for research in those infectious diseases very limited from African sources, and we have to rely on funding from developed countries. I think what this leads to is that once you look at products, things like diagnostics for these infectious disease in terms of monitoring, in terms of vaccines, and in terms of treatment, we source this from developed countries at a very huge cost. And this is something that is can't continue like this. And we saw when COVID came up that Africa was quite limited in terms of the vaccines that we could have access to readily, because we don't produce any vaccines. And this all stems from Africa and Botswana not being able to support their own researchers and research. So this is something that needs to be addressed in the short and long term. But it's good that Botswana now is waking up to this, and for more recently we have received some funding from the Department of Research, Science and Technology to do some of our research, and we hope that this is something that continues and that those funds can also be increased. And we have seen recognition of our local scientists as well being given awards for the research that they do, and this is something that is commendable. So I think if we can get more research funding locally and recognition of scientists for the work that they do, this will go a long way in making sure that we can really live the knowledge-based economy that is so much talked about, because ultimately for the next pandemics we need to be able to generate our own diagnostics and also our own prevention strategies, it be vaccines or treatments. To young scientists out there or those that are considering going into science, I just want to encourage them to venture into biomedical research. It might not be the most paying profession out there, but in terms of impact, I think has some of the greatest impact. And I think basically looking at the impact that the biomedical research has had in terms of curbing the HIV/AIDS pandemic, I think we have seen that the interventions, be the treatment, be the the monitoring have had in terms of curbing the HIV/AIDS epidemic. So I think we know that the prevalence of HIV remains quite high in our setting, but now people are able to live longer because of the treatment and also the different interventions that have been arrived at through research. And I think I would definitely encourage young upcoming scientists to venture into biomedical research. And with the advent of more funding coming from local sources, I'm sure in the future it should be possible now to develop vaccines and develop diagnostics locally and regionally, such that by the time if we get another pandemic, we are self-sufficient in terms of addressing these pandemics.